Hello friends, in this video we are going to discuss few important clinical rubrics given in repertory. The objective of this video is to identify chapters and locate rubrics for symptoms or conditions related to surgery. So starting from Kent's repertory, the chapter generalities contains this following rubrics: injuries, wounds, suppuration, abscess, ulceration, fistula. Skin chapter: bed sore, suppuration, boils, abscess, cancer. Face chapter: cancer, facial deformities, swelling and necrosis. In chapter nose, we have nasal obstruction, epistaxis, polyp, cancer and caries. In mouth and throat, ulcers, epulis, caries, cancrum oris, cancer, boil, fistula, gums, condylomata, ulcers. In stomach and abdomen, we have rubrics like abscess, hernia, gangrene, gallstone colic, intussusception. In chapter rectum and stool, fistula in ano, hemorrhoids, prolapse rectum, fissures, cancer. In urinary organ, the calculi, polypi, tumors, gangrene, hemorrhoids of bladder, enlargement of prostate. In chapter male genitalia, the rubrics are hydrocele, tumor, cancer, gangrene, elephantiasis, condylomata, sarcocele. In female genitalia, prolapse uterus, ulcer, tumors, cancer, cyst, gangrene, warts. In chapter extremities, ankylosis, corns, caries, phalon, fistulous opening, regates, varices, etc. In chapter chest, pulmonary edema, all type of chest injuries. In chapter respiration, edema and respiratory distress. So in Boningussen's therapeutic pocketbook, we have following rubrics related to surgical situations or condition. The part or chapter sensation and complaints contains dislocation, hemorrhage, induration, inflammation, polypus, wounds. The chapter glands, which is a subsection of sensation, contains different rubrics like induration, inflammation, suppuration, ulcer. The chapter blood and circulation contains passive bleeding, blood poisoning, hemorrhage. In chapter bones, there are rubrics like caries, gouty nodes, and injuries. In skin chapter, the rubrics are ulcers, gangrene, wounds, warts, ingrowing nails. In Boger's Boningussen's characteristic repertory, the chapter sensation and complaints in general contains some rubrics like injuries, hemorrhage, fungoid growth, suppuration, polypi. Skin chapter contains wound, ulcers, suppuration, gangrene, burns, scalds, sarcoma. Chapter bones, again having some rubrics like fracture, caries, necrosis, exostosis, ganglion. Chapter extremities, the ganglion in hand and foot, ulcers, abscesses, gangrenes, callosities. The inguinal and pubic region contains rubrics like hernia and its type, abscess, pneumatocele, pustule. The eye and vision, we have rubrics like pharyngium and cataract, nose, polyps and warts. The face chapter contains cancer and warts. Chapter mouth contains nodes and noma, fissures, gangrene, ulcer, necrosis of hard palate, abscess of tonsil. The chapter stomach and abdomen contains gangrene, cirrhosis, ulcers in navicular region. And in chapter rectum and anus, we have rubrics like fissure, fistula, hemorrhoids, prolapse of rectum. In perineum, we have abscess, fistula, prostate gland enlargement, and urinary organs, suppuration and calculi. Genitalia male having different rubrics like phimosis, suppuration, ulcers, hydrocele. Female genitalia having rubrics like cancer, abscess, cyst, polyp, prolapse, varices, subinvolution of uterus. Chapter larynx and trachea, polypi, ulcerations. Chapter chest, gangrene of lungs and hydrothorax. So as we can see above, the three basic repertories, Kent, Therapeutic Pocketbook and BBCR, contains various clinical rubrics and clinical conditions and the medicine related to those conditions. Now, how they all are going to help us? Now, repertory guides towards a group of medicine, but not the simillimum, and one must find out scope and limitation of homeopathy in each surgical cases. So, it doesn't mean that repertory is having a rubric and related medicines that we are supposed to treat each and every surgical conditions. We have to find out the cases where we have scope of homeopathy, and if we have limitations, then we have to give some other mode of treatment. The next is, in every surgical case we require some surgical advice from some qualified surgeon, which is going to improve the prognosis, and I prefer the surgical references must be done throughout the treatment. One must also take help of modern investigations and judge the action of medicine and condition of patient with the help of investigation. So don't just go with the subjective symptoms. Also take help of modern investigations like laboratory reports, X-rays, CT scan, MRI, ultrasonography reports, etc., and evaluate how the homeopathic treatment affecting the surgical condition. Lastly, to follow the advice given in aphorism number 186 in Order of Medicine, where Master Hahnemann has clearly written how you are supposed to treat pseudo-surgical cases and true surgical cases, and which are the scopes and limitations of homeopathy. And lastly, the homeopathy can cure or palliate the surgical diseases, but we have to find out the cases and we have to work accordingly. We have the case. So this is all for the surgical rubric and its management in repertory. For more topics like this, please visit my blog and YouTube channel. Thank you.